How do we respond to students with disabilities and/or behaviour disorders? Every student is unique and deserves instruction beyond one size fits all. It is necessary to provide learning opportunities for children with special learning needs such as learning difficulties, behaviour disorders, and/or a disability. Learning cannot happen without a safe, secure and comfortable environment for students which will enable engagement and make students feel valued and successful. For example, differentiation will help to meet the needs of all students. These children have various abilities and learning needs and need to be identified and assessed using the government disability criteria by the school counsellor located in this link. Another link provides resources for students with special education needs and/or disabilities. There are a number of different strategies that teachers may include in the management of students who present with learning difficulties, a disability and/or disorder, for example, ADHD, which stands for Attention Deficit Hyperactivity Disorder. ADHD is becoming increasingly common, and as such we'll be focusing on this, but does not stand alone. A number of elements will be identified to help a teacher evaluate the behaviour and make an assessment regarding the most appropriate approaches to utilise. Students with ADHD have difficulty screening out irrelevant information. They have attention difficulties and find listening and following instructions difficult, especially if there is a great deal of other activity going on in the classroom simultaneously. They can be distracted more easily to new, colourful or moving stimuli or items hanging down from the ceiling in classrooms. They usually enjoy and remain more focused when playing computer games. Students with the hyperactivity component seem to be unable to keep still. They wriggle, move out of their seats, talking excessively, loudly, and fidget with anything available. Behaviour disorders generally come with related problems such as learning difficulties, including reading disabilities, and spelling and mathematical problems are often associated with ADHD students. Behavioural problems have also been widely connected with ADHD. Both learning and behavioural difficulties can lead to a range of other problems such as motivation and low self-esteem. Social rejection are very frequent. ADHD might lead to higher levels of antisocial, oppositional, and aggressive and even violent behaviours. There are a number of behavioural discipline strategies ranging from Cantor's assertive discipline model to Rogers' decisive discipline model. Teaching students with behavioural disorders are challenging and may need a more highly structured teacher-directed instruction, but this doesn't mean that the classroom is not student-centred. Sometimes a more formal learning environment is required. Another strategy is through the integration of technology in the learning process. Technology helps students with low attention spans. For example, students with attention deficit disorder, ADD, or attention deficit hyperactivity disorder, ADHD, can be aided through the use of technology by engaging the student and facilitating the learning process with different methods and through providing them engaging activities to stimulate their learning. This is a link that provides strategies to draw from for behavioural approaches.